Hello guys. Back by popular demand, you guys loved Dr. Tony Youn last time I had him on, as did I. He's an amazing friend of mine. He is America's holistic plastic surgeon and he's a wealth of knowledge. And last time he was on, we covered so much information about tired eyes, hooded lids, bags under the eyes, and also neck, crepey neck, turkey neck. And we talked about things like what can you do surgically? What are surgical options and when are they appropriate and when are they necessary to achieve the result that you're looking for? And we also talked about non-surgical options, minimally invasive options, things like Botox, fillers, and we talked about DIY. Tony, there you are, right on time. I'm excited to have you back. So we talked about all those things, and you guys just were asking so many great questions that I thought, Tony, you got to come back. So there you are, right on time, Tony. I just gave a little intro into how you're back by popular demand because so many people wanted to continue the discussion and just think about, different parts of the face, different parts of the body. So thank you for coming back.
Hey, no problem. Thanks for asking me to come with you, and hi to all your followers as well as mine.
We've got a lot of people already joining. I saw that right away, right on time, guys. I love it. So I tried something new this time too. I asked for questions from my audience using that sort of little question, whatever it's called on Instagram. So I'll try to throw those in every now and then. If you guys did submit questions, we'll try to get to those as well. So again, this is Tony Youn, America's holistic plastic surgeon and awesome guy all around. And last time we tackled a couple different areas. Today, based on your requests, you guys asked about 3 different things. Number 1 was jowls. And I think I must have gotten 8 different DMs, 14 emails, and people call them different things, a saggy jawline, jowls, laxity in my lower face, my face is falling down, gravity. So, it goes by a lot of different names, but a lot of people want to talk about jowls. So like last time, we're going to talk about surgery. When is it indicated? When is it necessary to achieve the results? Are there other options? What else can we do? I think I got a question. Let me see if I can see. I think it was on. Oh yeah, we got a couple of really interesting ones here about facial yoga. Let me see if I can put that one on the screen. So that has to do with jowls, right? Can facial yoga help with saggy skin, jowls? So, I figured why don't we start with jowls and jowl 101 from Tony Youn. So what do you think?
So I think that it really comes down to how bad they are. So from my perspective, for those people who are in their 30s, 40s, and even 50s, there are things that we can do that are non-invasive or minimally invasive, but you have to be realistic with what they can do for you. Yeah. So there are skin tightening treatments that can help overall, but these are not things that are going to create these dramatic effects. And so you and I know that we have patients who come in to see us, they go, oh, look how loose I am. And they may be in their 40s, and you look at them like, I mean, a little bit. Then there are people who are in their 60s who have true jowls. Right. You can't really treat them the same way.
Yeah.
So I think, if you're not to that point where you need surgery, where things are real saggy, that the only thing that you can do is literally pull things up surgically, there are a number of options that can help. Things like radiofrequency microneedling. We do some of that in my practice. We have something called the Fractora. I think that is nice. Some people use ultherapy, which is ultrasound. That's non-invasive. I don't have that in my office. And then there are even some things you can do, little tricks with fillers that I find that can help in certain people as well. So sometimes I see people who've got fairly thin, narrow faces and they have some looseness here. And by actually adding some filler out into the sides of the jaw and along the jawline, you can get some minor lifting that way too. So, I mean, that's what I have seen in my practice. I definitely would be curious to see what your thoughts are.
Yeah, well, if somebody, I'll tell you what I do normally, but first let's just talk about the surgical candidate. So if somebody comes in and they really do have that laxity, they have sort of that saggy skin, and you assess them and you think, fillers, ultrasound, radiofrequency, even microneedling, radiofrequency, just not going to do the trick. This is surgery. How invasive a procedure is that, and how is it different from? I hear a lot of terms thrown around, like a mini facelift or a lower facelift or a neck lift, or I have patients who come back and say, oh, my mom she's not getting a facelift, she's getting a mini partial. What does that really mean?
So it is very confusing, and a lot of physicians are confused, much less patients. So really, a facelift is a facelift, whether it's a mini facelift or a full facelift or a lower facelift. It really treats mainly the lower face and the upper neck. So there are some people who will do an isolated neck lift, making a little incision underneath the chin. I'm not a fan of that operation because usually there's skin that you need to put somewhere. And so sometimes doctors will make a little incision underneath the neck. We'll defat the area. They may tighten and tie together the platysma muscles. But the issue that I've always seen with that is what happens to the redundant skin.
Right.
Sometimes it just looks kind of bunchy there. And so I'm not a fan of that operation. So when I do it, I usually will combine the neck with the lower face. And you can get a little bit of tightening of the mid face, which are the cheeks, with it. And I call the lower facelift. But a lower facelift and a facelift technically is the same thing.
Thank you for saying that.
A facelift has nothing to do with your forehead. It has sometimes not a whole lot to do with your cheeks. It mainly is everything from here on down, including the upper neck. It's a terrible, really, a facelift is much more accurately termed a lower face and upper neck lift.
Thank you. And what do you charge, or what is the going rate in your neck of the woods for that kind of a procedure, and what's the downtime?
So it could run anywhere from $10,000 to $25,000 or more, depending on who does it. Typically, it's a minimum of a 2 to 3 hour surgery. Can take as long as 5 hours. Some surgeons take that long to do it. I usually do it under a general anesthetic. I have my patients spend the night overnight in a hospital room. Some people will do it under a local with sedation as well. So there are a number of ways to do it. And the other thing you mentioned was what is a mini facelift? Well, mini facelifts can be anything from people putting barbed sutures into the face called threadlifts, which I am not a fan of.
We'll get there.
To these lunchtime type facelifts that were done back. They'd had these commercials for Lifestyle Lift where you make kind of quick incisions here and you do a little bit of skin removal, a little muscle tightening. To some people, like for me, when I do a quote unquote mini, it's basically a lower facelift done on somebody who doesn't have that bad of aging. So scars can be a little bit shorter, surgery a little bit faster, but essentially it's the same thing.
Okay, awesome. So what I do in the office when I see people who have jowling, usually, if they really do have extensive jowling, I do refer them to a plastic surgeon. I refer them to you if they're willing to make the trip because your results are unbelievable. But if they either don't want surgery or maybe they don't need it yet, there are many, many options. I see Eileen asking about threads, so we'll definitely get to threads, I promise. So one of the first things that I look at is I'll play with the skin. So I'll sort of palpate and I'll use my fingers to create vectors, and I'll see if I lift a little bit here, if I lift a little bit here, we've got a fascial layer that's connected throughout the entire face and neck. So sometimes if I put a little filler into the temple, a little filler at the zygomatic arch, we have a bone here. If you guys feel, it's almost like a shelf. So that's our cheekbone. If you put a little filler there, if you put a little filler at what we call the gonial angle, that's our little jaw angle right over here. So if I find that using those different vectors, if I play around with somebody's skin and I lift like this and I see the jowl area tighten up, then I may say, you know what, we may do some fillers in you. I might even put a little filler into the chin itself, because if you think about it, like a tennis court with a net, and one side of the net is hanging on this pole, one side of the net is hanging on this pole. If you sort of pull the poles apart, the net tightens, right? So some people, if they have a little bit of a recessed chin, or if they have a collapsing angle of their jaw, by putting in a little bit of filler in those two places, you can tighten up that beautiful angle. And a lot of people actually had that. If you look at pictures of them from 10 years ago, 5 years ago, you know, we're not talking about, you know, creating a masculine jawline in someone. We're talking about bringing back, there's almost like osteoporosis of the face that occurs over time. I'm sure you've done cadaver dissections and you've looked at skulls, right, of a 20-year-old and a 40-year-old and a 60-year-old, you know, and you can actually see the different parts of the bone have gotten thinner and thinner. And so what happens to the skin on top of that bone? It collapses down. So if you can sort of rebuild that. So I saw somebody was asking about different fillers that I use for that. So you can use, I'll use a lot of Juvederm Voluma in the temples and in the zygomatic, in the lateral cheekbone area. I love using this amazing technique that I learned from an injector in Canada using Restylane Define, and he calls it the adhesion, I call it the adhesion technique. I don't know what he called it, but we actually put a little bit of filler right in the angle, and then I'll put struts over here in sort of the submalar region, and then I actually have the patient hold up their face. I say, pretend like you're getting a facelift and hold it up on this side, and then I inject the other side. They hold up on that side. And then when I let it go, there is something to that sort of binding. It's almost like glue between, if you put it in the right sort of spaces underneath the skin, it can actually make it hold up a little bit better. So I see we're getting a bunch of questions, but threads, we got to talk about threads. So tell me, you guys have probably heard about threads, and they got a lot of press in the last 3 years or so. So what do you think, Tony? What's your opinion on threading?
So you're younger than me, and you may not remember when I first started my practice in '04, threads just started getting really popular. And these were threadless, where essentially you take a normal suture, and these were permanent sutures back then, made of nylon, and they would make little barbs or little cuts into the suture. And so when you pull the suture through tissue, those little cuts, those barbs would actually then engage the tissue and hold on to it. And then what people would do then is would take these sutures, they would run it through the skin as a way to pull things up. And initially you would see the barbed sutures pull the tissue and literally lift it up. And then they would basically pull it up and then just cut it at the surface, sometimes make a knot, sometimes not. And this was really popular back in '04 to probably '07-ish or so. A lot of doctors were performing it. There were a lot of non-core doctors, meaning internists, family docs, people who weren't real dermatologists or plastic surgeons or facial plastic surgeons doing it, calling this a non-surgical facelift. Right. Well, the problem is that the studies that were performed showed that these procedures lasted at most 6 to 12 months. And then years later, they would find that there are these permanent sutures sticking out through the surface of their skin that we would have to try to pull. I love to eat your butt.
I'll be right back.
Oh, and so then they would have literally a 6-month result, but have years of issues with these sutures pricking out through their skin. So then what happened over the ensuing years is
spitting sutures, right?
Yes.
If somebody's had surgery and something's coming out, it's very uncomfortable, and you get a foreign body reaction. It's not fun.
And it's in your face.
Yeah, it's in your face.
So then these companies stopped making these after a while, and then years went by, and a new crop of doctors have come up who haven't done their research, and they go, oh, there's this great idea of putting these threads through your face. It's new, and now they're absorbable. Let's do that, and let's charge $1,500 per thread we put through your face. But the problem is anatomically, it just doesn't make sense that one suture with tiny little cuts into it is literally going to lift your face, which is many pounds really of tissue. It makes no sense. And maybe in the office it will look like that, but in reality, long term, it doesn't do anything. Now, there was a study in the Aesthetic Surgery Journal that was published probably within the last 6 months that did actually look at the longevity of these and found what I said, 6 to 12 months at the absolute most. So my patients, I tell them, look, if you want to do threads, they're not necessarily dangerous or anything like that, but you could spend upwards of $6,000 to $8,000 and get a minor change for 6 months. And if for you that's good, then go ahead and do it. Most of my patients would not be happy with that type of cost.
Absolutely. And that study clearly showed the duration is very poor, 6 to 12 months, and the effect is gone. And the side effects, it's hard to even call them side effects because they're expected. having puckering and redness, and that's just a normal part of the threading process. But then the real side effect, these buds are just not going to happen.
Your ears are too small probably for them.
They are. My ears are very small. I think I talked to you about this before. I'm like, my buds won't stay in. So anyway, I hear you. So something weird happened with the buds. They automatically knew that they were out of my ears. But also the other side effects that people are seeing with the threading is migration, right? So if you put the thread in one place, all of a sudden, and I've seen this during an interview on somebody on TV that actually had a thread. It was so distracting. As she was speaking, you could see the thread had obviously migrated. You can get infections, you can get scarring. So, yes, sometimes things sound exciting and sound new, but in this case, it's not new. It's a new version of something that we've seen before, and, when you think about the risk-benefit ratio, it's something that I have not adopted for so many different reasons. So I say we're already halfway through our time. We have so many questions already, and I still have all those little questions at the bottom of the screen that I want to get to. So the second topic that sorry guys, facial yoga. So go ahead, tell me about facial yoga. Let me look at other questions that might be relevant to Jowls. But what's your take on facial yoga?
So facial yoga is basically in general, there are two different types and things that you do. So facial yoga, a lot of it, I think, makes a lot of sense when you're doing facial massage, you're doing relaxation of your face. We do know that overexpression of your facial muscles can create wrinkles. So we have patients all the time, let's say you have a patient with a lot of extra skin of their eyelids. So they're always lifting up their eyebrows to help open up their eyes. And what happens, they get these deep furrows in their forehead. And so we do know that Botox does the opposite of that. It will then weaken muscles that cause you to make these expressions. And we find that the wrinkles are smoother and they don't get as deep if you do that. Well, the issue with face yoga is, once again, if it's the relaxation part and facial massage, then I'm all for that. Increasing blood flow, once again, relaxation, that's all good. It's the parts of it where they say, okay, make these extreme facial expressions over and over again, and that's going to strengthen your facial muscles to lift everything up. In reality, it's most likely to do the opposite. It just makes sense that if you're making these extreme expressions and you're creating these lines by really flexing these muscles, those are not the muscles that are loose that cause us to age. The muscle that loosens that cause us to age are the platysma muscles and the SMAS, the superficial musculoepineuritic layer, basically, that is a different type of muscle. So, the idea of it sounds good, and I think parts of it, once again, with relaxation massage, I'm good with that. But yeah, doing this over and over again, squinting your eyes, that's just going to make your wrinkles worse, don't you think?
So much worse. So, and I get this question all the time. So one of the muscles over here, guys, the depressor angularis oris, they pull down the sides of your mouth. Ooh. Okay, I inject those. For those of you who come into my office, I sort of have these weird spots that I inject in your lower face with Botox or Dysport. That's to actually relax those muscles so you don't make that expression. And we call it resting bitch face, RBF, when you overexpress those muscles and it starts to lead to basically a droop in the sides of your mouth where the corners of your mouth start to turn down and you look like you're always angry. So what do? I do a little Botox or Dysport there in those muscles to stop them from pulling down. And then I'll put a little filler into what I call the oral commissures, which are the corners of the mouth, to help support and turn those areas back up. So if you fight me by doing facial yoga at night after I'm doing all those things in the office, it sort of defeats the purpose. So no, I don't think that those are a great option. We're having so many we're going to have another one of these, Tony. I got so many questions on totally different topics. And
here's
the ones that you guys submitted.
Here's one that somebody just asked. Booging Cats, face rollers. What are your thoughts about at-home face rollers?
I'm not a fan. I do that kind of thing in the office all the time using sterile technique. I do vampire facials. I do microneedling plus PRP. I take your blood, I spin it in a centrifuge. I separate out the plasma, which is rich in growth factors, and I paint it on the skin. I'm very fancy with all those things, but guess what? I'm wearing gloves. It's completely sterile, and I'm going down to the depth I'm actually measuring and changing the depth based on the area of the skin that I'm treating. And if you're doing it at home, first of all, a lot of those devices are not going deep enough to actually change the matrix. They're sort of basically breaking up your stratum corneum. You might as well scrub your face with a harsh buff puff or sponge, which I don't really recommend. And that it may enhance the penetration of some of your ingredients. But if it is going deep enough, a lot of my patients who have tried to get the deeper ones online, because nowadays you can kind of find anything online, they're not using sterile technique, and they're sort of dragging it in. It's not necessarily perpendicular to the skin. I've seen infections. I've seen impetigo. I've seen scars. I've seen a lot of complications. So I'm not a fan of trying that at home.
Yeah, no, I would agree. I think a lot of it comes down to depth. And, I haven't seen, because I'm not a dermatologist, I don't see those types of things coming in. To me, it makes sense that if you've got one that's, 0.2 of a millimeter, that it's probably not going to cause you any true issues. But is it going to help a whole lot? That's the big question. Or, but once again, those are patients that I don't see. They would go see a dermatologist if they develop some type of issue like that. I know some
positive would be enhanced penetration of some of your ingredients, if you want to get, increased penetration. But the fact that you're doing it without using sterile techniques, people are probably not taking as good care of their at-home devices as, my office. I'm literally using a brand new one for every patient, so, if you're not doing that and you're sort of keeping it somewhere next to your sink, where you brush your teeth, I just don't know if it's worth the benefit of a slight enhanced penetration when you could easily use a glycolic acid, lactic acid, leave-on serum, or a face mask or something like that will dissolve away the uppermost dead skin cell layers called the stratum corneum, and it will enhance any penetration of any ingredients you put on afterwards that evening or the following evening. So there are so many safe ways to exfoliate and enhance penetration. I still haven't convinced myself that those are really worth the risk. Etched lines, because I did promise we have to do etched lines and acne scars in the next 8 minutes. So etched lines, I think the question last time, there were a couple people who said forehead lines that are etched. So I sometimes see these etched, the angry 11s. Sometimes I see horizontal forehead creases that get etched. Sometimes I see crow's feet that get etched. And guys, the way that you can tell if they're etched is if you're a woman and your makeup creases in there and you find yourself sort of smoothing it out, that's a sign that it's etched. So is there anything that you recommend for people who see those kind of etched lines, whether it's at home, products, ingredients, treatments, procedures, anything that you recommend for that?
I see that in a lot of people who have a lot of chronic sun damage. So I see mail carriers quite often have those types of lines. And the other group of people who I see have those are smokers, people who smoke for a long period of time. And these lines are just so deep. I don't have great solutions for them. I mean, you can be quite aggressive with resurfacing, like doing fractional lasers. We could do moderate depth TCA type peels. We have one that we do called the controlled depth peel from Zeo Skin Health. But even those, you're really not going to get a whole lot with it. My feeling is some of those areas you could try Botox first. So if you've got crow's feet, if you've got the 11 sign, the forehead, you have to be very careful with Botox because it can really change how your eyebrows look. But my first step usually would be to see what we can get with Botox. I always recommend using some type of a retinol or retin-A at night. And then if you can do some type of resurfacing, that would be the other thing to try. But like pitted acne scars, these are tough. Like it's hard to treat those things. And to get a big improvement is really difficult. I mean, if only it was as easy as putting a filter on your phone to get rid of these things.
Right. So when it comes to etched lines, because I see a lot of those in my office, so I agree with you. The frown lines here and the crow's feet, the first thing I do is I'll start with Botox or Dysport because sometimes, surprisingly, people do respond. But if they don't, or if they come to me and say, oh, Botox failure, I tried and it doesn't work, there's this incredible way of addressing those etched lines. It's with Bellatero, and I use a tiny 31 gauge needle, and I inject very superficially. So if you imagine that the wrinkle, the etched line is here, I actually inject so that it's slightly elevated above the surface of the skin. It almost looks, I tell people, you're going to look like a cat scratched you when you leave my office. And it can take a couple of hours to even a day or two for that elevated line to settle back into the skin. But when it does, it can really fill in lines that have been etched for years. So my patients are very, very pleasantly surprised with that, but it is uncomfortable. The pH of the product, it's very acidic. It stings when it goes in, and you have to inject. You can't really use numbing cream because the numbing cream actually makes the skin swell, so you lose your landmarks. The wrinkles go away when you wipe away the numbing cream. So you have to really, I blend it. I actually mix the Bellatero with a little bit of extra lidocaine to help make it a more comfortable procedure. And you have to be okay with walking out of the office with, a lot of what we do is, lunchtime procedures. Nobody's going to know you did anything. With this one, you do have a little bit of downtime because you do look like that sort of cat scratch you. But a lot of my patients are able to get away with doing that even once a year, once every other year, and it is dramatic. I agree with you, lasers, resurfacing. I do a ton of lasers for that type of issue as well. But I always start with the filler. I find that the filler is like the biggest bang for the buck. And people are really surprised. And some of them are happy enough. They don't go on to do the lasers, and others are more perfectionists. And then they follow it with a series of lasers. But those, I love doing that. But exactly what you said, the forehead lines, guys, I never start with Botox up here. If you have etched lines up here across your forehead, that means that you're relying on your frontalis muscle to keep your eyes open. So if you relax that muscle, if you stop that muscle from working, it's going to smooth out your forehead wrinkles, yes, but you're going to walk around and feel like your eyes are very heavy. It may create hooding on the lids or just give you a really bad headache. Acne
Totally
scar.
true. Have you tried Restylane Refine for those lines, those etched lines?
So
because that's a nice thin product.
Refine, I haven't tried it for the etched in lines because I have to admit, I inject a lot. So I have, my practice is closed. I can't accommodate any new patients. I'm literally injecting all day long. Refine is when it's coming out of that tiny, tiny needle that gives me the precision. It really hurts my arthritis, my thumb. It makes it really painful. So I've been blending the Bellatero, and it just comes out so beautifully that it's been my go-to. I bet if I blended down the Refine with a little bit of lidocaine and made the viscosity a little bit less dense, then, hey guys, then I might, I'm getting lots of hello and loves from people that I know. But yeah, it may be something that I'm always open to trying new things. So, it's when something works, it's hard to mess with it, but I'll give it a try. Acne scarring is very, very tricky. I do, when it comes to, so I do a lot of microneedling, I do a lot of Fraxel, and I tell people like, oh, it's really not that much downtime, you'll be able to get back. I treat a lot of people who are TV personalities. They're able to be on live TV the next day. That's not the case if you have acne scars. If you have acne scars, it takes about 8 to 10, anybody who tells you otherwise is lying. It takes about 8 to 10 procedures. It's a mix of fillers, usually Sculptra. If you sort of deflate it, a lot of people notice that their acne scars get worse in their 40s, 50s, 60s when they lose collagen. It's almost like a deflated balloon, and the acne scars get a lot worse. So we need to reflate, we need to give back the collagen, the structure, the scaffold to the skin. So it's a mixture of fillers plus deep microneedling plus deeper lasers. So for those procedures, people are sucking on the Pronox. Do you have Pronox in your office? It's been like the best thing ever for me.
I've thought about it. Yeah, we haven't needed it, but that's something I have looked at.
It's been really helpful. I used to give people a lot of Percocet and Valium, and I practiced in the city, but also in the suburbs. So it was always an issue when people were trying to drive home because I didn't feel like they were safe. I made them wait in the waiting room until their significant other came to pick them up. Pronox is basically laughing gas, and it's out of your system within 5 minutes, and I let people drive in 10 minutes, and it's incredibly safe, and people are just, sort of high during the procedure, and they're incredibly comfortable. So I'm able to get a lot deeper doing those microneedling, doing the different types of resurfacing lasers for the acne scars than I was able to in the past. I think I'm going to, in the last 1 or 2 minutes, I want to just see if there's any, let me see. Okay, so acne scars on the body. So same thing with on the body as on the face, quite honestly. You can use hyaluronic acid fillers into the scar. You can do microneedling. You can do Fraxel. You can do different types of resurfacing lasers. Tony, if you saw any questions you want to answer in the last few minutes, let me know. Otherwise, I'll
let's
look here.
see. There were a couple questions. Okay, go ahead.
Firming products, devices for maturing skin. Oh, I saw a question about a jade roller too. So that's sort of a device. So what do you think about jade rollers?
And what is it, the gua shia or whatever? Gua sha, yeah. I mean, I think those are fine. I have one in my office somewhere.
I have one somewhere too.
So I think that they're fine. Basically, for those of you who are not sure what it is, it's a little stone roller, and a lot of people typically roll under their eyes. You put it in your refrigerator, your freezer, get it nice and cold, and it's just a way. Same thing as if you're putting cold cucumber slices over your eyes. That cold temperature helps to deflate the area. By actually rolling it, you may be able to push out some edema, some fluid. And I think it's a real nice thing to do at the end of the day. It's a nice kind of self-care type of a thing. But at the same time, some people, I think, try to make it more than what it really is. And that's the important thing, is it's not going to get rid of eyelid puffiness or wrinkles. But, for what it is, if you take it for what it is, I think they're fine.
Yeah, I love when people say it's very specific about the direction of the jade rolling. And, you and I know anatomically, you're not pushing fluid from here over into the lymphatic system. Like, you can't actually put it where you want it to go. So I mean, just doing any kind of massage, especially with a cooling device, can sometimes help, boost that sort of circulation, that lymphatic drainage. But when people sort of make it into this very sophisticated science with directional, advice, it's really not that helpful. And then for the best firming products, I mean, as far as firming, how to firm the skin, retinol, right? Retin-A, peptides, some growth factors have firming benefits to them. Vitamin C can help. Our body needs vitamin C to make collagen. So those are, and then actually glycolic acid, products with glycolic acid, they may not be able to say it on the label because that would create an issue with FDA allowing it to be a cosmetic or an over-the-counter makeup product. But, we know from different studies done by companies that offer chemical peels that have glycolic acid in them, that can trigger collagen production in the skin, which can lead to a firming and tightening effect. So those are the biggies. I want to keep going, but I feel like we have to wrap up. Do you have any closing words of wisdom, any last things you want to throw in?
I think it's great because, I mean, you know more about skin than I do, and I'm used to being in the operating room, and I think it's important, where I trained, a lot of the dermatologists and plastic surgeons didn't mix because people look at it as a turf war, and it really isn't. I think that, you guys know what you know about the skin, and we're mostly in the OR, but then, there are dermatologists who do surgery as well who are great at it, and there are plastic surgeons who do skincare that's great at it too. But I think the important thing is the collaboration, I think, between our specialties. So important because we can help patients better that way.
I love that we have such an open dialogue. Clearly by the response today, we got to maybe 1/20th, 1/30th of the questions that were asked. So I hate to do this to you, but I'm going to put you on the spot. I'm going to have you come back.
Someday here soon.
We'll do it again soon. All right, guys. Thank you all for tuning in. And Tony, thank you so much for joining me. This was awesome.
Always great seeing you, Whitney.
All right. Bye, guys.
Thank you. Bye, everybody.